Hi everyone, I'm Michael Uriarty or Dr. Mike, and welcome to Technique Talk, the MYK System, and more. This is episode 9 in our series of comparing and contrasting other techniques with the MYK System. Today, we're diving into Myofascial Release, a technique developed by John Barnes, PT. If you want more information on either technique, I have the website links in the description below. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. How did myofascial release begin? Myofascial release, or MFR, that's the abbreviation, was developed by John Barnes, a physical therapist, who recognized the crucial role of the fascia in musculoskeletal health. Now, John graduated from the University of Pennsylvania as a PT in 1960. Boy, we're going back a few years. He said he was a very logical person and accepted the theories taught in school to be factual. He then had a life-changing injury that shredded his belief system in an instant. He was a good athlete in many different sports growing up, but after the injury, his strength was tested both mentally and physically. He was training for an upcoming weightlifting competition, and he was squatting quite a bit of weight. He squatted down, but he couldn't get back up. And he thought, I'm a good gymnast. I'm just going to roll backwards and, get out of this. Well, he ended up herniating his L5 disc and ripping some lumbar ligaments. At first, he didn't have any feeling in his lower body, but after a few minutes, the pain started, and it was bad. He started looking into different treatments, but nothing worked. He ended up getting back surgery to fuse his lower lumbars. This helped decrease the intensity of the pain, but he still had pain and limited range of motion. He started treating himself, lying on the floor, and found over time that he actually responded better with lighter work than with deeper work. He also realized that his problems were in the fascial restrictions that lie before you get into the end range of movement. He knew that he had stumbled onto something, and he began putting his myofascial release technique together. Now, the fascia is a continuous web of connective tissue that surrounds and supports muscles, bones, nerves, and organs. When this tissue becomes restricted due to injury, inflammation, or surgical procedures, it can lead to pain, reduced mobility, or even health issues. John Barnes developed myofascial release to address these fascial restrictions. Now, myofascial release involves applying gentle, sustained pressure into the fascial system to release restrictions and restore normal function. This technique aims to improve blood flow, reduce pain, and enhance overall mobility by targeting the fascia directly. What is the theory and philosophy of myofascial release? The core philosophy of myofascial release is that fascial restrictions can lead to widespread dysfunction throughout the body. By releasing these restrictions, MFR aims to restore the body's natural alignment and improve overall function. Fascia is unique in that it can become tight and rigid, forming adhesions that restrict movement and cause pain. MFR practitioners believe that sustained pressure and gentle stretching can help release these adhesions and promote healing. The technique emphasizes listening to the body and feeling the subtle changes in tissue texture and tension. From what I have found on multiple websites, there's not really an exam to do this technique. It's more like, let's get in there and find the tight and tender area. With the MYK system, we actually do a postural exam. It's like a checklist. You say, let's say that you can see one shoulder is lower than the other, one elbow is more flexed than the other, and one thumb is more extended than the other. On our list, we go, check, check, check. We see those postural imbalance. What does that tell us about the nervous system? When we have a cause, we fall down, we lift something incorrectly, we have too much stress in our lives, we overindulge in too much of something like alcohol or smoking or, whatever it may be. Something goes wrong, and at least 3 areas have a problem, and that is the bone, the muscle, and the nerve. So say that the cause, let's say that the cause is that you fell down or you're in a car accident. So this is a quick force that knocks the bone out of place. Well, when this happens, one muscle on one side is probably going to go a little bit shorter, and the other muscle on the other side is going to get a little bit longer. And this imbalance interferes with the nervous system signals. So this started with the bone being knocked out of place first. Now, let's say that you lift something incorrectly. So the muscle contracts too hard and you pull a bone out of place. It goes to one side. That means that one muscle goes short, the other muscle goes long. The bone is out of place, and now it's impinging on the nervous system signals. But this problem started with the muscles. So it really doesn't matter how it starts. The end result is very, very similar. We're going to have a problem in the spinal segments. We're going to have a problem in the muscular system, and we're going to have a problem in the nervous system. So once this issue begins, the second that the person stands up to gravity, the body is going to compensate to keep us as upright as possible with the greatest range of motion and the least amount of pain. And this is where the MYK posture chart comes into play. We will find the original postural imbalance, but we're also going to find the compensatory postural imbalances, and this leads us to the primary nerve problem. Most of the compensations will happen on the original nerve pathway. So if we go back to our original example of a low shoulder, flexed elbow, extended thumb, let's say that ends up being a C6 problem. When we treat everything on the C6 nerve pathway, the person stands up, and now the muscles that we just treated send a signal up to the brain that say, hey, I'm now in this new position. I'm in this more balanced position. And the brain, when it receives all this information, it says, hey, all these other muscles that you guys never even touched are going to have to contract or relax based off of that problem. And this happens instantly. And when the person stands up, what happens is you'll start to see postures balance. And once those start to balance, you're going to find out that pain goes down and range of motion goes up. And I know that was a very long explanation, but I wanted to get that out there. All right. What can myofascial release help with? So they have a treatment page on their website. I have it in the notes below. So if you go, you can go click on that, and it's myofascialrelease.com/treatment. And they list many things on this page. And so you can click the link and look at all the conditions that they list, but it's designed to help with a variety of conditions. And I'm just going to name a couple. I'm just going to name a few, but they say that they help with chronic pain, fibromyalgia, headaches and migraines, TMJ problems, scar tissue pain, myofascial pain syndrome, postural issues, and sports injuries. Now, the goal is to reduce pain, improve mobility, and enhance the body's ability to heal itself by addressing fascial restrictions. The conditions that we say we treat with the MYK system are going to be pretty similar to the list that is on the Myofascial Release website. With the MYK system, we also get into helping with specific organ problems. Now, that's in the third class that we have. That's the autonomic nervous system class, and we get into the different organs, how to speed up, how to slow down, how to open up, how to close, that kind of stuff. What does the practitioner do? With myofascial release, the practitioner will apply sustained pressure and gentle stretching to release fascial adhesions. Hands-on techniques that will improve blood flow and promote relaxation. Sessions are typically slow and methodical, allowing the fascia to gradually release and adjust. Treatments can be anywhere from an hour to an hour and a half. With the MYK system, there's a postural exam. Then we treat each muscle on the nerve pathway with a passive and an active movement. And if we find any tender spots or sore areas or restricted areas, we're going to spend a little bit more time on those spots. But the treatments are anywhere from 3 to 15 minutes, depending on the nerve level that you're going to be treating. What professions do they teach? How many CEUs? And how much do the classes cost? Myofascial Release 1, 2, and actually there's many others that are about 20 hours in length. You get 20 CEUs. All of these classes cost about $800. I know that he teaches massage therapists and physical therapists and, those professions. I'm not sure about other professions. With the MYK system, our upper and lower body classes are 20 hours, and the cost is about $600. We teach massage therapists, PTs and PTAs, OTs and OTAs, chiropractors, athletic trainers. We've taught nurses in the past, personal trainers. So there's a few. Okay, let's do a summary of the similarities and the differences of myofascial release and the MYK system. So some similarities. Both techniques focus on soft tissue. So both techniques recognize the importance of soft tissues, muscles, and fascia in maintaining overall health and function. Personalized treatment plans. Both systems emphasize the importance of a personalized treatment plans based on the individual assessments. Now, with myofascial release, the assessment's going to be done during the treatment. They're going to find things and they're going to release those areas during that time. That's my understanding of how that is done. If you know more about myofascial release and if there is something else to that, definitely in the comments let me know so that I can make a second video and correct some of this if any of it is wrong. Number 3, the classes, the hours of the classes. So both myofascial release and the myokinesthetic system offer 20-hour classes. There's some other ones that are more for both of us, but that's the gist of it. That's the bulk of it. You can get most of the information. And the conditions that we treat, again, another similarity. A lot of the conditions that we say we treat are going to be very, very similar. Now, let's look at some differences. So some differences. The foundational principles. So myofascial release focuses specifically on the fascia and its role in musculoskeletal health, while the MYK system integrates the musculoskeletal and the nervous systems together in the treatment. So the techniques used, another difference. Myofascial release involves sustained pressure and gentle stretching to release fascial adhesions. The MYK system incorporates a wider range of techniques, passive and active movements along one nerve pathway. Another difference, the assessment methods. So myofascial release relies on tactile feedback to identify fascial restrictions, while the MYK system uses a postural chart to or if you want to call it a checklist, to determine the specific nerve level involved. And then personalized treatment plans. I had that as a similarity, but I also have it as a difference because MFR is personalized because what they find and where they find issues will be different on each person. The myokinesthetic system bases each treatment plan off the specific nerve level determined to be the cause of the person's problem. And then another difference is the class costs. So myofascial release is about $40 an hour per CEU, and the MYK system is about $30 an hour per CEU. So in conclusion, both myofascial release and the MYK system offer unique approaches to improving health and addressing pain. Myofascial release focuses on releasing fascial restrictions to restore normal function, while the MYK system addresses the musculoskeletal and the nervous systems holistically. If you're a patient or a practitioner, understanding these differences and similarities can help you choose the best approach for your needs. For more information on either technique, check out the links in the description below. Thanks for tuning in. Be sure to hit the subscribe or the follow button. And if you made it this far, smile.